Despite being among the most common health problems in the country, nearly half of those with thyroid disorders are undiagnosed. Because symptoms of thyroid disease can mirror those of other conditions, vary widely, or be altogether absent, the first line of defense if you think you might have a thyroid problem is being informed. Joining us today to educate viewers on thyroid disease is Dr. Jeffrey Garber and Jennifer Karol, who is a thyroid patient. Guys, thanks for joining us.
Thanks for having us.
Thanks.
Doctor, let's start with you. Tell us a little bit about the thyroid and what is the thyroid's role in keeping the body working properly?
Well, I just happen to have a model with me. The thyroid is a small gland located at the base of your neck. This is the windpipe. And despite its small size, its importance is great. It influences the way your body produces energy. It controls metabolism. You can either produce too much thyroid hormone or not enough when the thyroid is diseased. If it produces too much, it can make you warm all the time and lose weight. If it doesn't produce enough, it can make you feel cold and gain weight.
And what are some of the symptoms of thyroid disease?
Well, they range depending on the organ system that's affected. If you have too much thyroid hormone, you can be anxious. If you have too little, you can be depressed. You can have frequent bowel movements. If you have too much, you can have slowed down bowel movements. Your skin can be sweaty and warm. If you have too much, it can be dry and cold if you have too little. And every organ system that you mentioned, we can come up with a symptom if the thyroid is severe enough and you're susceptible to those kinds of symptoms that it can affect.
Now, Jennifer, how did you discover you had an issue with your thyroid?
I discovered it when I was 18 years old. I felt some of the symptoms Dr. Garber mentioned. I went to my physician and I had a routine blood test that showed I was hypothyroid.
And why did you seek the care of an endocrinologist?
Well, after my initial diagnosis, I continued on medication. Then after the birth of my second daughter, I really wasn't feeling well. I went to my primary care physician who just said, oh, your hormones are out of whack. You're going to be okay. Well, a few months later, I still did not feel right. Something just felt off. I had a lot of the symptoms Dr. Garber mentioned, and I just felt terrible. So I found an endocrinologist and worked with him to try to figure out what was wrong.
And as someone who has been dealing with thyroid problems, what advice would you offer other people with some sort of thyroid disorder?
Well, in my case, for example, I found a great endocrinologist. We worked together, and it turned out that I had thyroid cancer. So definitely find an endocrinologist that you feel comfortable with, that's able to hear what your problems are and work with you through blood tests, through ultrasounds, to try to get some answers that you feel comfortable with.
And doctor, tell us a little bit about ACE's Same initiative.
Well, January is Thyroid Awareness Month. This is the 18th year of our campaign, and this year our theme is Same, which is another way of emphasizing consistency. It's consistency about taking your medicine to control your thyroid condition, most notably an underactive thyroid, which requires precise replacement. And the way to do that is to take the same formulation, which is the same medication made by the same company, whether it's a brand or generic, to take the same dose and take it the same way every time, each day, which means separated from food and medicine. And by doing that, you'll maintain your levels in a consistent fashion and be well controlled.
And tell us a little bit about ACE's neck check.
Well, the neck check refers to examining your own neck in a mirror, and that can alert you to the fact that there may be a thyroid problem, because even though a thyroid may be off, there may be a lump in it, it may be large, it doesn't necessarily mean it's not working, but it certainly would warrant attention. So for those with a family history or have symptoms in their neck, looking in a mirror and using a card with instructions on our thyroidawareness.com website, that's one word, thyroidawareness.com, you'll get instructions about how you can check your own thyroid out in that fashion.
Great, great information today. Again, just alert viewers where they can go for more information.
Again, it's thyroidawareness.com, that's one word, thyroid awareness.
Jennifer, doctor, thanks for joining us today.
Thank you so much for having us.
Thanks.